My name is Maria Bryant. I'm the chair of ASO. I'm just going to take over from Kath in this second half. I'm going to start by introducing our panel chair. So we have Professor Susan Jebb. She's a Professor of Diet and Population Health at the Nuffield Department of Primary Care at the University of Oxford. So Susan is also a government advisor on obesity and is going to get started this evening with a summary of some of the activities that have been discussed and the announcement this week. So I'll pass you over to Susan.
Hello there. Well, goodness me, this webinar is occurring at an incredibly timely moment. It's been an extraordinary week. I can't remember such a significant week for obesity policy, perhaps in the whole of my career. Not just the obesity plan, which we've heard quite a lot about, but also the walking and cycling strategy that Harry mentioned. And I think importantly too, the interim report from the National Food Strategy, which has had a particular focus on inequalities and really trying to provide some of that nutritional safety net that we heard Barbara touch on.
Susan, can I just ask you to turn your camera on, please? I think you might have it covered.
I thought I was on.
Thank you.
The camera looks like it is on here.
Yeah, you're on now.
Sorry.
You've got a piece of paper. I think you've got a piece of paper in. That's it. Thank you.
There we go. Silly me. Sorry. So I think what's interesting to ask, and certainly I'm sure policy researchers in the future are going to ask, why these policies and why now? My immediate thoughts are that this has been a very particular moment. Ministers, including the Prime Minister, have really woken up to the impact of obesity on health through the lens of COVID. And what that's done is to alert them to the very, very serious health consequences of obesity and the impact that that's having on the NHS. I think it's also been a bit of a wake-up call for the public. We've seen some of the data this evening showing how people's eating habits have changed, how their exercise patterns have changed. And suddenly people have started to realise that actually their weight is perhaps a bit harder to control than they thought. And so they're looking for some extra help and support and have perhaps been a bit more open to policy intervention. I think the other important thing that's happened is that these announcements really reflect the body of applied health research that people have been working on for years and years and years. It's not only researchers that have been generating the evidence, but it's been all the action by civil society groups to mobilise the public. It's been stakeholder engagement. And of course, the Department of Health and PHE, as we've talked about already, have been really crucial. So there were a lot of policies which were ready to go. And that shouldn't take away from the fact that they have been launched. That's incredibly important. But I think it's also reassuring for those of us who are sort of been working on these things for years and years and years to kind of remember that sometimes you just have to wait for the opportunity and then you can present the evidence. And it's really important for us to keep at it and to be, yes, celebrating the moment for what's in this, but also thinking about what are the next steps. There's just one final thing I want to say before I open it up to questions from the audience. And that's really that I think one other thing that's happened is a bit of a shift in tone towards one of rather greater support. I mean, Harry made a very good point about the challenge of choice, but I think squeezing out the advertising and promotions of foods high in saturated fat, sugar and salt will actually make it easier for people to, in a way, do what they're trying to do, which is to have a healthy diet. But also we're seeing a much stronger language of providing support for weight management. And that I think is incredibly important. At the moment, it's very much pitched at largely delivering tier 2 weight management services at scale, recognising that there are 2/3 of the adult population who are overweight. But I think that's a very important step towards getting better provision of treatment services more generally. And the time will come for us also to be trying to put in place the more specialist services, which I'm sure we all recognise are needed. So definitely a moment to celebrate what we've achieved, but of course we also need to look forward and ask what's come next. And perhaps I can start this discussion off by actually asking each of the speakers just very quickly for your highlight and your policy, your next step. And I guess to crystallize that in terms of an actionable policy. And for example, Harry, you said, oh, we need to do more to narrow inequalities. What is that policy that you think is going to deliver? Harry, I'm going to let you go first, and then we'll run through the panel in order.
Thanks, Susan. As you know, I once wrote a piece called "The Single Most Important Intervention to Tackle Obesity." And the single most important intervention to tackle obesity is that there is no single most important intervention to tackle obesity. So there is no one intervention to deal with inequalities, but there are, I think, a number of things that one can think about here. One, I think really importantly is, of course I understand the political context, of course I get that. And I agree with you, completely agree with you about needing to be seize these opportunities when they crop up. But it's 13 years since Foresight. We know what to do. Some of this stuff was in chapters 1, 2, and 3 of the Child Obesity Plan over several years now. And yes, it's finally there. But, I guess I go back to what Sally Davis did in her report not all that long ago, just saying this isn't enough. And if we're going to try and hit these really hard targets, we're going to have to do much, much, much more. So that's one bit. I think another thing is there's a whole load of really structural things that need to be done about inequality for much more than just obesity. And what that really involves is getting to grips with not just the causes, but the causes of the causes. We need to look at income distribution, education, quality of the built environment, a whole load of things. But what we really, and that absolutely needs to happen. But what I really worry about here is that some of the stuff that's being put in place is actually likely to make inequalities worse. So that's my big concern here. Carrying on with a push on choice, on individual responsibility, when we know that doesn't help, it seems to me is a profoundly unhelpful thing to be doing. And just one example.
Are you suggesting that we shouldn't have calorie labeling? Is that where you're going?
I'm not suggesting we shouldn't, but I think it comes a long way down the list. So let's think about calorie labeling on alcoholic drinks. I've just done some work looking at the ways in which the alcohol industry puts labels on alcoholic drinks. And it does it in a way to obfuscate and hide and all of that. But actually, we know that minimum unit pricing is an effective and equitable mechanism to reduce the consumption of alcoholic drinks. They could just put minimum unit pricing in place instead of having a consultation on calorie labeling.
Sure. I think it is this tricky thing though, isn't it? We can all think of policies we'd really like to have in, and we should continue to advocate for those. But it's very challenging then to say, so that means you shouldn't do these other ones. And we never quite know whether, because it almost certainly isn't a substitution. It's not, you haven't got ministers saying, well, shall we do minimum unit pricing or shall we do labelling? Oh, let's decide. And I think that is, I agree with you, but I think it's really hard.
No, and I take your point. I guess I just worry about opportunity cost. And the longer we have a focus on individual responsibility, the longer it's going to take to deal with this, and the longer it's going to take to deal with the inequalities.
Okay, I'm going to draw Barbara. What are your thoughts, Barbara? You started to allude to them at the end of your presentation, but what's the...
Yeah, it's hard, isn't it? It's hard to pick from the very long wish list. When we've just conducted a study with parents, we've just published a study, and after TV advertising, the marketing tactic that they find most hard to manage, and it doesn't always translate into additional eating, but it translates into family trauma, is the use of cartoon characters and toys and all the things that attract their children towards the unhealthy food, and the fact that the majority, more than half of those products, tend to be high in fat, salt and sugar. And that's coming from parents. So and they put that second in their list after TV advertising. So if we've got TV advertising, that's what they would like. On a personal level, having been working around the holiday provision issue, for me, I would love us to create a school food culture that is fully inclusive, fully universal, and really healthy, and really get that right, so that, you know, for 190 days that children are in school and the support systems that exist out of school, there is a consistent drumbeat of healthy eating, healthy diet, nutrition education going on in our schools. So I'd like our schools to be healthy food zones.
There's one question coming in here, Barbara, which I'm going to ask to you in just a moment, which is about how important is cooking and nutrition education in schools. But whilst you're just thinking about that, can I also remind all of those people who are listening into this webinar today that you can email in your questions, and we will try and get through as many of them as we can today. So Barbara, cooking and nutrition in schools, I guess that preaching to converted.
Yes, and we work with the Food Teachers Centre, is one of the members of the Children's Food Campaign, and one of the things that they're concerned about is there is now a shortage of trained, qualified nutrition teachers and food teachers in our schools. There's a lack of adequate facilities. I think with kind of the challenges of social distancing, some of those spaces may become compromised. So, you know, we are seeing where schools have adopted a really holistic approach, and they've got little growing spaces, and they're integrating food and nutrition education across different subject areas as well. So you can teach maths through recipes and things like that. I think you can create a much more healthy culture. And a lot of young people have reported, a lot of teenagers have reported that they've done more cooking at home during lockdown. In the lower income brackets, some of those children have been having to do that because their parents were out working, so they've been stepping into the key worker role. But family meals are still a real challenge. So that kind of cooking and eating together culture, I think is really important.
To turn over to Ken now, because Ken, you told us about some of the work that you've been doing in gathering views from patients and people living with obesity. What I'd be really interested in is what's the view from that community about the announcements we've seen this week?
I think there's a universal concern about the lack of specifics about improving access to specialist weight management clinics, and in particular breaking down the barriers and access to bariatric surgery.
It's a tricky time, isn't it, for back to be talking about bariatric surgery when you know, we're trying to keep people out of hospital. But I guess that this is largely pitched at a sort of public health kind of approach, isn't it? It's managing obesity at scale at the minute. But do you think that will build a sort of greater understanding of the need for treatment, and that some people are going to need more specialist services? Do you think that will follow?
All of the people that I work with, Susan, wish that these policies had been in place when they were young, and perhaps they've been prevented from getting to the position that they're currently in. And I think that I've been around for a few years in weight management and obesity, and it's always arguing about public health or treatment, local authority or NHS. And I guess what we've got to try and do is work all together for the good of the population.
Yeah. Louisa, perhaps I can draw you in at this point, just on this issue of expanding weight management services. What are your thoughts on that part of the plan, given the review you've been doing about the kinds of services that people need?
Yeah, well, it's really interesting, Susan. I mean, to me, one sort of positive that I think is coming out is this move towards a far more person-centered approach, using non-stigmatizing language, and kind of that recognition that there isn't a one-size-fits-all. And that really did come out strongly out of the rapid piece of research we did with regards to digital. But it's really good to see that sort of diverse range of services, acknowledging that, you know, obesity is a really complex disease, and there will be different drivers and motivators for different individuals. individuals, and having that range of services and range of approaches to address that complexity and those individuals' person-centered needs, I think is really promising. And what I guess I would like to see more of, and I think this touches on the inequality, how we sort of go about addressing the inequalities, is actually starting to work more with our communities in need, rather than kind of doing services onto, can we co-develop those services more with those communities in need, so we can ensure we're actually addressing what's needed and providing products that really are tailored to what people really do need.
Thank you. Jamie, there's a question here which I'm going to ask to you, and that's really the comment about what are your thoughts on the lack of focus on the value of registered dietitians, and instead an emphasis on training up healthy weight coaches? Are you able to comment or reflect on that? Is that just about scale? Is that just because we don't have enough dietitians, or is there something more behind that?
I think it's a really important question, isn't it, Susan? And I don't think that necessarily the absence of mention of registered dietitians doesn't mean to say that the government doesn't value and recognise the role that they play, because indeed we do, and they're very busy people, aren't they? The inclusion of the healthy weight coaches, I believe, is, as you say, to add scale. And within primary care networks, which already have these linked workers working to link patients into community-centred approaches, i.e. social prescribing, I think the idea is that maybe those roles that are trained up and upskilled to deliver these healthy weight conversations and dialogue. Clearly, PHE have a role to develop said training, and we're going to be working with NHS colleagues, DH and Health Education England to use that new healthy weight competency framework so that we can be, and I think that, just to pick up what Ken said and what Louisa said, clearly getting the training right so those healthy weight coaches can deliver empathetic, supportive messages to people living with overweight and obesity is going to be crucial. And I think I'm really excited that there's an opportunity to develop that type of training and to get issues of stigma built in there so that we can try to prevent that from happening in the first place.
Mm-hmm. Thank you. There's lots of questions coming in which are around the whole issue of food and nutrition in schools, cooking, training, healthy eating habits from a very early age, including one question here from a midwife about whether there might be community approaches to helping people with cooking skills, particularly sort of low budget cooking skills. Barbara, I don't know if you're able to comment on that. I know there are a number of schemes around at the moment. Do you want to tell us more about that?
It's not my direct area of expertise, I must admit, and I don't know if Harry's got something to add. I mean, there are plenty of community initiatives springing up at local level and through local food partnerships that are connecting people with growing and cooking and bringing different communities together. And I think there's a role for everything. I think one of the issues is then also tackling people's access to affordable, healthy ingredients, cooking facilities at home. And so I think sometimes there's been a mismatch in the way that advice and nutrition education is handed out, and then the reality of what people are having to live with at home. So it needs to be very, it needs to be really rooted in a solid demographic understanding of the communities that you're working with. And I think that's why we do need to have that devolved approach and involve communities themselves in designing those programs. That would be my response.
I'm going to have a little change of tack, and back to the issue of inequalities. And rightly, many people are very, very concerned about this. The disparities, the inequalities in the prevalence of obesity in children is particularly marked, but we see it in adults as well. But the question really is, I guess it's back to the question I was asking Harry. What is it that we can do which we feel confident it is going to help tackle inequality? Are we expecting too much, that's going to be delivered through the obesity plan? is that actually something that is a much broader structural thing about tackling poverty and deprivation? Who am I going to pitch that one to? Harry, I guess. Harry, how much do you think the obesity plan needs to do this thing, and how much is this just a call to the rest of government to really get at those root causes of so much of the inequality we see in society? Or is it a bit unfair to blame the obesity strategy for not tackling poverty?
Well, I guess I'm going to repeat a bit of what I said before, because I think...
no repetition allowed. I'm going to channel my inner just a minute.
So no, but I guess yes and yes. So I think absolutely there needs to be a core focus on inequalities. We've got inequalities widening all over the place in this country, and COVID-19 is making them worse. It's revealing them, it's worsening them, and it's entrenching them. And whatever form our recovery from COVID-19 takes, it looks as if those inequalities are just going to get worse. So there is massive cross-government action needed to deal with those inequalities. And it is absolutely unfair to lay all of the responsibility for that on the obesity strategy. I completely agree. But the bit I'd repeat is, I nevertheless think it's essential that the obesity strategy doesn't do things that we know are likely to risk widening inequalities. And yes, there may be some short-term wins that are about getting things on board. Even if they have a short-term worsening, as part of a bigger picture, we might need to accept some of those compromises. But I just think it is not acceptable to have an obesity strategy where we're doing things that we have known for years are not going to make a big difference, probably won't be very effective. We're wasting effort and money and attention on them, rather than putting money and effort and attention into things that will have a bigger impact and are less likely to widen inequalities.
Thank you. I'm going to move on, and Ken, I'm going to come to you now. So the question has been raised about the issue of tackling stigma. And I think it is now widely accepted that one of the challenges we have in tackling obesity well and effectively is because of a degree of stigma and discrimination. And the question that we've been asked is, does tackling stigma need to come first before we start trying to introduce these other policies, which we've seen in the obesity plan this week? Ken, what's your thought about that? Should it come first, or do we need to add something else in which will help that?
I think it's one of these situations where you've got to do everything all at once, and I think we've got to have a public awareness campaign about stigma. We've got to have a healthcare professional training campaign about stigma, and we've got to have some messages to people living with obesity about stigma. Because I think I talked about it in my presentation about the internalized aspect of that. And it's a difficulty with any of these things, just picking out one area. But stigma does under sort of pin a lot of the prejudice and discrimination that people face about getting access to treatment.
Mm-hmm. Thank you. We've got a number of questions here, or comments really, from people who are concerned at the lack of weight management services in their local area. So again, coming to Jamie now, my understanding is that part of this plan is actually about putting together some national commissioning or national provision of services. Is that correct? Or how will that work with the existing local authority provision? Jamie, do you want to take that on?
Thanks, Susan. Yeah, I mean, as Louisa and I have sort of presented today, we already knew before the pandemic that there was variation in access to behavioural weight management and obesity services across the country, and as Louisa presented, it seems as though that's got worse. And so there is a need, as we articulated, to be able to support services to get to carry on providing those virtual and remote services for people that are finding them useful. At the same time, yes, we do need to also think about the restoration of services in areas that pause them, because people living in those areas are, frankly, they may not have any access to a free at the point of access service. And I think that is a clear priority, and that's something that in PHE we're committed to working with us, whoever wants to work with us, basically, Susan, to get that across the line. Yes, I think that, you know, Harry's made some really important points about that, the individual level actions and weight management services and how that fits in. And Ken has quite importantly emphasised, you know, more specialist clinical services. And, you know, we know that colleagues in the department and NHS England Improvement are working hard. You know, there was the vision of the long-term plan, which was going to scale up and deliver approaches that would sit alongside local authority commissioned behavioural weight management services for people with type 2 diabetes and hypertension. And I know that the team are working hard to think through how to adapt that so they can move that going forward. I do want to take this opportunity though, that, you know, I agree completely with Harry, who over the years has, you know, infused me with his, you know, with his articulation of the complexity. This is really complex. There isn't a single solution. We need to put people with the lived experience at the heart of what we're thinking about. And, you know, in PHE, we're committed to doing that. There's no doubt about it. I think that we've proven in the past we put that into place, and we need to do that ever so more importantly now. But changing the environment so it's more health promoting is clearly something that in PHE we're invested in and really committed to drive forward as part of all of these range of options that we've seen announced this week.
Thank you. Well, I think probably what we can all agree on is that getting, junk food advertising off the television, off online, my goodness, what a big win that is. Transforming, well, maybe that's going a bit far, but at least starting to make a difference in grocery stores. So we get promotions off those prominent locations. Those really are incredibly important steps to changing the food environment. And, you know, I'm really looking forward actually to seeing the evaluation that I know will go alongside this and hopefully we can learn from that. I hope that government and ministers are going to be encouraged by the fact that having announced the advertising ban, goodness me, the sky has not fallen in. And it is possible to do these things. And actually, broadly, I think the public have been very, very supportive. So on that note, I think we're going to have to draw this to a close. It's been fantastic to have so many people in this discussion, and thank you for all your questions. We've covered most of the topics, if not all of the individual questions. So at this point, I'm going to hand you back to Maria. Thank you.